Okay.
Hang on, I gotta find my mouse. There we go. Okay, so what's happening to my skin? So I took this presentation from the general vantage point of aging, but then I'll follow up with some more general things if we have time. I'm hoping that suits everybody well. And this was a nice, often these talks are a nice way for me to kind of refresh myself on all the things that I know, but I want to make sure I know all the details really well. So I want to tell the story of two stories of how I got into this. The first one is that, and I think everyone has done this at some point, but I was having a low day. And so I decided to go to Winners and buy something nice for myself. Has anyone not done this? So I went to Winners and I went to the natural healthcare section and I found face serum. And I bought it. It was about $10 and I knew nothing about it. I knew what to look for in terms of bad things, right? So I knew it didn't have anything bad in it. I just didn't know whether or not it was going to do anything actually good. It was a supplement serum that contained retinol. So I brought it home and I used it, and I was fully aware of the fact this was probably just an act of self-care as opposed to anything that would bring any big results. And to my surprise, my skin looked better with this $10 face serum. And I was like, oh, this is interesting. I did not expect this result. And so that kind of piqued my interest and I started to research more. And then the other thing that got me in this direction was a patient who I'll often give myself homework assignments during an appointment. So a patient will ask me a question and I take it as a point of pride to not say things that I don't actually know, right? I'm not doing my job well if someone told me something once and then I just stated as a fact. So they asked me about collagen. I said, my understanding is that you can't actually just eat collagen to have it turn into collagen. It doesn't really work that way, but let me look at the research and I'll get back to you. And then again, I was really surprised by the research in terms of collagen. So that's how I got into being a lot more inspired and educated about all of these things. So I'm going to start out with the three main things that happen to your skin when you age. I always feel like sometimes these talks are kind of not so fun, right? Let me tell you about all the terrible things that happen when you age, but it's nice to kind of know the details. So three things. The first is you have decreased cell turnover. So I think we've all heard that that kind of the phrase or the thing that goes by that, your whole body regenerates in the course of 7 years. Obviously, we know that isn't entirely true because you hold onto a scar for longer than 7 years or, degenerative things stick around. But this idea that a lot of the cells in our body are turning over constantly. Turning over means that the cells grow old and die and are gotten rid of and new cells replace them. So as we age, the new ones aren't replaced as regularly and fully as possible. And that's often referred to, the term for that is atrophy. Photoaging is the second thing that happens to your skin as you age. So that's exposure to the sun primarily. And the main thing that happens is that it causes oxidative damage. So you've got your, they're called reactive oxygen species that are the things that damage the skin. And we're more familiar with the term antioxidants for things that repair the skin. And so that photoaging, one of the neat things is that we can see what it does to the skin outside of aging. And so the three main things it does is it causes the skin to kind of thicken up, and it causes it to become discolored, and it also causes oxidative damage. The third thing that happens is a decrease of connective tissue. So connective tissue is the thing that joins our body together. So it's the tendons and the ligaments and the things that hold the skin together. And so when you lose that connective tissue, then you lose some of your plumpness, you lose some of your elasticity, and it's more easy for your skin to be damaged. So I have a diagram for that. One second here. There we go. Okay, everyone can see that? Okay, so this is a diagram of young skin versus aging skin. So at the top, you have the cuticle, which we know is the cuticle in your nail, but it's also on top of the skin. And then the epidermis, and the dermis is where we have the collagen. So the collagen is a framework that holds the skin in place and keeps it from sagging and wrinkles from developing. And so the white long things are collagen. And then the epidermis is the fatty layer at the bottom. So we have different kinds of collagen in our body. So type 1 is skin, bones, teeth, tendons, and ligament. Type 2 is cartilage. Type 3 tends to be more related to the connective tissue that holds the organs in place. And type 4 is the one that separates the sections of the body. The overall collagen loss on the skin surface is about 1% per year once the aging process begins. So I hope that makes sense to everybody in terms of that framework is what holds the skin in place and keeps it resilient. And as that framework goes, then the skin can start to sag, and that can lead to things like wrinkles. That. There we go. Okay. So the other thing that tends to happen with age is the loss of hormones that are beneficial for the skin, excuse me. So one of those hormones is melatonin. And melatonin is something that we've talked about before in terms of you have that surge of cortisol during the day, you have that surge of melatonin at night. And talking about the fact that if the cortisol isn't balanced, then the melatonin may not be balanced. The melatonin, its primary action in the skin is to serve as a potent antioxidant, so to help to repair the skin from damage it experiences. And then there's also the decrease in sex hormones. So estrogen is really helpful for stopping that atrophy process. So it keeps the skin cells regenerating. And it also helps with the oxidative stress. And then even going back a stage, there's a hormone called DHEA. So DHEA is produced by our adrenal glands, and our adrenal glands take over our estrogen production once our ovaries stop doing it at menopause. And this is super important because your adrenal glands also push out your stress hormone cortisol from the same section of the adrenal glands. So when we are functioning in too much of a state of stress, then that can make the adrenal glands prioritize or focus on the production of the stress hormone cortisol and not produce as much of that DHEA, which turns into the estrogen that keeps us going after menopause. Did I say that in a way that made sense to everybody? Okay. I have this new setup and my mouse vanishes. It always takes me a second to find it. There we go. Okay, so getting into topical supplements that help. And I always have to give you guys the disclaimer that I can't, just make a recommendation to all of you. So this is general information, and how this applies to your health and your skin will be something that needs to be a little bit more personalized. But my 3 favorite things for putting on the skin are a form of vitamin B3 called niacinamide, vitamin C, and retinol. So retinol is a name for the active and most effective form of vitamin A. And like I said, this was a surprise to me that these substances were so helpful. So you get from the niacinamide, the B, you get a better fat barrier on the skin, you get a better cuticle on the skin, you have reduced inflammation, and it helps a little bit with collagen. The vitamin C and the retinol tend to be more just focusing on the collagen and that antioxidant effect. So you can also use some oral supplementation to help. And so not in Canada, but elsewhere in the world, you can actually take DHEA as a hormone, which is a little bit it's a tricky thing to do, which is part of the reason it's not legal in Canada, because it's not as simple as just take a whole lot of DHA and everything gets better, right? Everything needs to be in balance. Antioxidants are really helpful. So if you take the antioxidants internally, then it spreads to your skin and lets your skin do a better job of dealing with the damage of the world. But then the most fascinating part was taking collagen can actually help with collagen. So part of the reason that there was a perception that collagen didn't work is because you need to take a form of collagen that's referred to as hydrolyzed. So hydrolyzed means that it was processed in a factory to make it able to withstand the digestive enzymes in your digestive tract and actually get into your bloodstream. Collagen is frequently made from the parts of animals that are not used when meat is produced. And this is something that I'm not sure everybody knows, and it's always a little bit interesting to tell them. So it's often made from animal hide. And I'll tell you what, the supplement companies sure keep that on the down low. Sometimes they'll talk about how it comes from grass-fed beef, and that gives you like a little bit of an idea of where it comes from, but it's the extra parts of the animal. And so if you think about it, you're actually consuming animal skin to help with your skin. So the way it actually works is to give you, so the collagen's made from amino acids, and amino acids come from protein. And it's little bits of amino acids. So it's like building blocks, very small building blocks, so that your body can produce what it needs to produce to form that collagen. And it seems to stimulate collagen production. And so what else do I want to tell you here? One of the neat things is that a particular form of collagen is now being picked up by conventional medicine because it has really good evidence for helping with wound healing after surgery. So it's starting to become a recommendation that surgeons and medical doctors will give as part of a recovery protocol. Same idea, right? You're looking to repair that skin after a surgical wound, and it gives the body a little bit of a boost to do that and all the building blocks it needs to be able to achieve that goal. But there's also really neat evidence on it. There's in scientific study, there's something that's referred to as a systematic review, where somebody goes through and looks at all the studies that are decent to look at and compiles it into a general conclusion. And so in 2019, there was a systematic review done that came to the general conclusion that oral collagen supplements increase skin elasticity, hydration, and dermal collagen density. So this is being done in clinical trials now. They're giving people collagen, and they are not only just asking the people how they feel about their skin, they're actually testing it. They actually have the ability to test the depth of the skin and to look at the roughness of the surface of the skin and see what's happening there. Yes, I see a question.
Yeah, I was trying to type it in the chat, but I couldn't send it for some reason. Is there an age when all this that you're talking about doesn't happen?
You mean like when it
like
isn't
you're saying the thickness and this, like when you put the retinol on in, it made a change, and
yeah,
and like I've tried every cream, but my wrinkles are still happening.
mm-hmm. And that's an interesting thing I get into in my world. Sometimes I'll recommend things and I have to explain to patients, like, let's be clear, a good result may be no further decline. And that's a weird thing to wrap your mind around, right? If you have something degenerative, I have to be like, let's make sure we're emotionally prepared for the fact that you may not leave my office and have some sort of miraculous recovery. It may just stop declining anywhere near as rapidly as it was. So to answer your question, I don't think this is what you were asking, but I think I want to just answer it really quickly. These things are happening before menopause because we are accumulating damage from the sun and accumulating damage from the world and accumulating toxins, but it picks up after menopause because you have the loss of that estrogen to help with the repair. And then post-menopause, you can experience improvement. So it isn't just that it isn't going to get worse. You can actually experience improvement, but of course it's not going to like take you back to 27. But it is, so to answer it again much more clearly, if you are supplementing with this kind of stuff for your skin, I would look for some improvement. I wouldn't just purchase something and say, okay, well, I know this is doing something good for my skin. I would try looking around for something where you actually notice a benefit. Yeah. I can't see very many people, so please feel free to unmute yourself and interrupt me, okay? I can only see 6 people at the top of my screen. Okay, so I also wanted to tell you about a study that was done in Germany. This was a study from, 2000 and I think it was 2020. So they took 72 women, 35 years of age or older, which I thought was interesting because at 35 years of age, you don't have as much obvious damage to repair. And they gave them a drinkable solution that had collagen, areola fruit, excuse me, not areola, acerola fruit, which is an antioxidant, and vitamin C, zinc, biotin, and vitamin E. And that combination brought huge benefits. So they got either the food supplement or the placebo for 12 weeks. And a skin assessment was carried out based on looking at the hydration, like scientifically, looking at the elasticity, and looking at the density. And then they asked the people how they felt. And the product brought improved hydration, elasticity, roughness, and density. And the positive effects remained after people took that supplement. And they noticed it. So this was a pretty big deal. So I'm going to touch on all the things that we can do, because the goal is always to do it as naturally as possible. Because, for example, if you purchase a collagen supplement, if you think about the fact that it's often made from animal hides, many things could go wrong in that process. There could be contamination in the factory. There could be built up toxins in the animal hide. There could be a sensitivity to that. It might not be the right balance. Like, there's all these things that could potentially be an issue. And I don't mean that to say, like, don't ever purchase a supplement, but the goal is to see if we can do it as naturally as possible. So one of the things that is really important for maintaining your collagen is blood sugar control. And actually, I'm glad I remembered this because I've talked to you guys about this before, but I am currently, which arm is it on? I am currently wearing a continuous blood glucose monitor. And I'm doing that in order to determine how my lifestyle affects my blood sugar. So it gives me a reading every 5 minutes, and I can correlate that with what I've eaten, my stress levels, my exercise, and determine what drives my blood sugar up and what brings my blood sugar down. And I have been finding it absolutely fascinating because the results were not at all what I expected. Yeah.
Hi, DL. Is that a service that you do with your clients?
Yeah. So this is, I'm guinea pigging on myself so I can get all the kinks out. And the product that I'm planning on using gives me the ability to have a clinical vantage point on the data. So it actually connects it to the healthcare practitioner. So yeah, I'm experimenting on myself so I can do it with whatever patient wants to do it. And I'm really, really excited about it.
Can we see it again? I just curious.
Yeah.
And it's sort of a computer chip or that they stick on your arm?
Yeah. So it's got a really strong adhesive and it lasts for 10 days. And so it has an applicator. I can show it to you. It's right here. It has an applicator. And so you just take the applicator and you put the sensor on it. You put it against your skin and you press this orange dot. And it's scary because it's inserting something into your skin, but it's like so much less painful than I thought it was going to be. The first time I did it, I was like, and I pressed the button and then it was fine. So it's got a little device here that transmits the information via Bluetooth. And then you can use a smartphone, or if you want to, you can spend extra money to actually get a device from the company. So that's the only drawback. There is a little bit of a need to have some tech savvy, but my intention is to set aside a block of time with patients and just do it with them, because it's been a process, many hours of figuring out all the apps, all the settings, all the ways to keep the data straight. And now I can walk someone through that a whole lot faster.
So yeah, that's really interesting, because that means you're correlating your stress levels, your eating habits, your exercise lifestyle, all of those things, and then getting a really good picture of where you're at.
It is fascinating.
Are they using this? Is a diabetic association or diabetes association using that kind of device as well?
So I'm not privy to exactly how it's being used. It is designed specifically for people who are insulin dependent, because it has algorithms that predict where your sugar is going so that you can get ahead of it, right? So if your sugar is going too high or too low, you can either inject insulin or have some sugar. So it is specifically for type insulin dependent diabetics. There has been some controversy in regards to the devices and how reliable they are. And so nicely in this circumstance, it's reliable enough for this kind of work, where I'm not depending on it to save my life in the middle of the night. It is interesting though, I'll tell you an anecdote. The first night that I got it, I had it set for an insulin dependent diabetic, and I ate poorly before I went to bed. And then my sugar was up and down all night long, and the alarm kept going off because it was going too low. That was a humbling and eye-opening experience about how what you eat affects your sleep and hormone quality at night.
Wow.
Yeah.
Oh, that's fascinating. You're right.
It's really interesting, and I'm really excited to start to offer it to patients. It's so empowering and so fascinating to see how your whole life is affecting it. Yeah. And so I don't know, like a few interesting anecdotes for me are how I eat before I go to bed profoundly affects my sleep, which I was not aware of. If I center my meal around good balanced options, complex carbohydrates and protein, then I can get away with adding extra things and it doesn't affect my blood sugar. And certain foods just destroy my blood sugar. So I had nachos this weekend and it was elevated for hours afterwards. It's so cool. Anyway. Oh, you're muted.
I'm really curious. You don't have to tell us, but what did you eat before you went to bed?
I had, oh my gosh, it was a disaster. I had some chips, a couple carrots, a cider, and some granola. It was a mess. It was just a mess. And I ate it not long before I went to bed. This is very unusual for me, and boy, my body let me know. And it was just like super low and up and super low and up. And it was, yeah.
Wow.
And so my new husband and I have been being guinea pigs at the same time. And so that's added an extra level of interesting, because we will eat the same thing and do the same thing, and then we'll compare what happens to our blood sugar. Yeah.
Is it an expensive tool?
It is an expensive tool, but there is a way to make it more manageable with the 10-day trial period. Yeah. And I think well worth it, because it's individual how you react. And we, you all have heard me talk about it lots over the years, that blood sugar regulation issues we're starting to understand are more and more foundational to a lot of health imbalances.
Mm-hmm.
Yeah. So in terms of sugar and collagen, sugar actually cross-links with the collagen fibers and turns them into what's referred to as a glycation end product. And that then is damaging to the system as opposed to actually supporting the framework. So it's just yet another example of how sugar's not doing us any favors. And so just to be clear, that sugar gets to the collagen through the bloodstream if we're not able to manage it in our bloodstream with insulin levels and insulin sensitivity and diet.
Wow. Jeez.
Another interesting aside in terms of what's happening with my skin, sugar regulation issues are also clinically tied to skin tags. So we don't yet have a known mechanism of action, but we see it frequently enough, being something that happens more often in people who have diabetes, that we're pretty sure there's a connection. And so that's an interesting thing if you have more skin tags to contemplate. It's again, we don't know for sure how it happens scientifically, but we're pretty sure it's a connection. So things you can do, help to balance your blood sugar, water. I can't tell you how frequently people come into my office not drinking even remotely enough water. They know they're not drinking enough water. And it's like, in the course of my career, people have started to come into my office and tell me what they're paying me to tell them, you know. I know I need to stop eating this. I know I need to drink water. I know this food is a problem for me. And then I'll just be like, you're doing my job for me. And then they go home and they drink the water and they make the changes and then things get better. It's kind of funny. So I can't overemphasize the increased water being important for your skin. It has a lot of water in it. And if you don't have enough water, and if you're not consuming enough water, your body's going to prioritize the things it needs for survival. Specifically, it takes water through your kidneys to help to eliminate things and keep things balanced. It's part of your detoxification process. So if you only have enough water for that detoxification process, your body will happily sacrifice your skin, right? It needs to survive today. It doesn't care what your skin looks like in 5 years. Well, I mean, it cares, but you know what I mean. Adequate sleep. Sleep is the time when we repair, including our skin. And then specifically in terms of diet, because I think this is a really important thing to talk about so that we're not just thinking of being dependent on supplements. So one of the most important things is adequate protein, because the protein gives us the amino acids that are used to make collagen. So as that process slows down, we want to give it as much of the building blocks to repair as possible. And I do see people eating a protein deficient diet a fair amount. Now, to be clear, if you're following some of the recommendations in North America right now, you will be consuming too much protein. So when I say I don't see people eating enough protein, what I mean is I see people eating a cheese sandwich and some soup for lunch, and there's no protein in that, right? Or they're having toast for breakfast. There's no protein in that. It's not about huge quantities of protein. It's about making sure that you have protein regularly in your diet. Because if we start to become less focused on diet and eating easier comfort foods, oftentimes those foods aren't adequate protein. I hope that made sense, because I really don't want anybody to get the impression that you need to go and have steak 5 times a day to have enough protein to keep your skin going. It's not what I'm saying at all. Vitamin C and antioxidants, and those go together because the way you achieve both of those things is by eating the rainbow. So antioxidants, the easiest way to identify them is colorful fruits and vegetables, or, well, no, we can go with colorful. So the berries and the brighter colors have higher levels of antioxidants as a rule. And the vitamin C is something that comes in those fruits and vegetables when they are not cooked. So it's an ironic thing, and I've told you guys about this before, that fruits and vegetables, if you don't cook them, they have more vitamin C and folic acid. If you cook them, the antioxidants are liberated. And so I always stress the fact that, we have a focus on raw food right now in our society, but cooking the fruits and vegetables actually brings lots of benefit too. And so that's just balance, right? It's nice to eat some raw fruits and vegetables. It's nice to eat some cooked fruits and vegetables. I personally find that I eat more cooked because that's what my digestive tract prefers. But I always encourage people to go with what sits well in their system once they eat it.
If you have any questions, everybody, unmute and ask your questions, okay? Rather than see the whole screen?
Can I?
You want you want the gallery?
Yeah, please.
Okay, there we go.
I still only see, I don't mind.
There's 2 pages, so.
I don't mind not seeing my head gigantic as I'm talking at all.
Okay.
Hi, Dielle. DL, you mentioned the collagen coming from beef, but lately what we see all the time is marine collagen. So what's the difference?
Yes, and so there are different sources of collagen that are being developed and put out on the market. And I actually would have to make that a research. I should have thought of that beforehand to see whether or not the marine collagen is as effective. I don't know whether or not it's hydrolyzed. So I'm actually going to make that a research assignment and I'll send that out. 1 second here. I got to tell myself right now or I won't.
Good, thank you.
But yes, we're definitely looking at diversifying the sources. And part of that is because not everyone loves the idea of eating cowhide. And I think there's pluses and minuses to that because I think it's nice when we use an entire animal. So when I say that, I hope I'm not coming across as too negative about it. That's not my intention at all. Good. Another question? No. Okay. So the other things that help are some of the minerals, zinc, manganese, potentially copper. And those minerals are things we can get from, I mean, the easiest way to describe it is just a varied diet. Some of the nuts are helpful for those nutrients, but the best way to describe it is just to have a varied diet. I want to talk about the fact that our skin is an organ of detoxification, and our skin is a way that our body can let us know what's happening inside. So it's very rare, and part of the reason that I'm a decade in to treating patients and still learning about these kinds of things is because I don't tend to go topical, just putting things on the surface when I treat people, because the skin is a reflection of what's happening in the whole body, and it works better to sustainably balance the whole body, and then the skin responds. So the skin is an organ of detoxification, and it reflects what's happening in the body. And so when you see like a lot of discoloration or angry skin or hives or things along those lines, that's a reflection of something that's happening inside of the body. Again, the connection about the skin and detoxification is something we have not proven scientifically. There are not clinical trials that have shown that, but it's something we see clinically. So an interesting thing that we would see as practitioners is a lot of discoloration or growths that are not cancerous over the area of the liver. This is a really interesting thing. And we would interpret that as a potential clue in terms of what's happening in the system. So another way to interpret that information is if you have a rapid change in your skin, that is information to pay attention to. So age spots are a normal process of aging. But if you all of a sudden have a lot of dark discoloration on your skin, then that's something to pay attention to and try to figure out what led to that. What is happening? Is there more of a toxin load? Another thing you can do for your skin, and this is something that I don't know if I've really talked too much about this before. I get into this conversation socially and people are always a bit shocked. It is not actually a good idea to cover yourself in soap on a regular basis. We tend to probably bathe a little too much in our society. We actually maintain a bacteria level on our skin that helps with the immune system function and keeping the skin healthy. And so when you are using soap all over your whole body too frequently, that negatively affects that bacterial balance. This is something that is scientifically proven. We've tested the skin and seen the healthy bacterial balance on the skin, but we're still learning how it all interplays. So this is where I get into the awkward position of suggesting that maybe when you bathe or shower, don't rub the soap all over all of your skin all of the time, but just go for the areas that need the most cleaning. I also just wanted to cover quickly, because I think it's nice to revisit it. It was nice for me to revisit it. the things to look for in moles to make sure that you are catching something that could be cancerous, because as we age, we get more things happening on our skin that we're not sure what's happening, or, is it cancerous? And so it's nice to file it away. So it's A, B, C, D, E. A is asymmetry. So if you have a growth on your skin that's not growing uniformly, it's like growing out on one side or very irregular in shape, that's something to pay attention to. And then B is borders. So if it has irregular borders, that's another indication of the possibility that it could be cancerous. C, color changes or more than one color. So once you have a growth that has an irregular border and it's not a regular shape and it's different colors, this is starting to tick more of the boxes. D is diameter. So if it's greater than the size of a pencil eraser. And E is evolving, which means that it's changing, it's bleeding, it's itchy, it's not stable. So it's nice to file those away to remember bigger than a pencil eraser, different colors, irregular borders. That's when you want to go to your healthcare practitioner and say, hey, what do you think about this? Yeah, I don't know why I laughed. That's not really funny. So those were the main things I wanted to talk about in regards to skin. So I think I would stop and see if anybody has any questions here.
Any questions? I have one.
Oh, you're muted.
I have a lot of fruit in the morning with nuts, and I wondered if you're supposed to spread that out over the day. I don't know, but I always feel hungry around 11. That's
So there's a bit of different things that go along with that answer. So it's always important to pay attention to what we refer to as the historical precedent. So if a whole bunch of cultures say a particular thing about food, there may actually be some basis to that thing that they're saying.
okay.
And so quite a few cultures are apprehensive about mixing fruit with other meals, other foods. And the general idea is that fruit breaks down faster. And so if it's with food that takes longer to break down in the digestive tract, then it could kind of get stuck there and not be processed the way you would like it to be processed. In Ayurvedic East Indian culture, they feel that if it's cooked into the meal, then it becomes more digestible. So that's an interesting thing. I would suspect for most people that fruit and nuts would be not enough to sustain you until lunch in terms of potentially blood sugar control, or just helping to keep everything stable. And I'm still piecing that together right now, just in terms of what I see with patients and what's happening with me with my blood glucose monitor. So to say that more clearly, one issue could be that breakfast would spike your blood sugar a little bit higher than your body might like. And then your body gives a big spike of insulin because it wants to deal with that situation, but it overshoots with the insulin. And then you end up not having enough sugar in your blood vessels. And that leads to that mid-morning hunger.
Yeah.
Does that make sense?
Yeah, it does. So that's where the protein would come in?
Well, so the nuts are protein. The other issue is just, does that sustain you?
Yes.
So setting aside blood sugar, I'm still piecing together the other aspects of what sustains you. So I have, I've said before, my gospel is the dinner for breakfast and seeing what profound changes that brings for people. So I am always open to the fact that some people may be sustained by less, right? So for me, just with my monitor, I had oatmeal for breakfast yesterday, and I had a big sugar spike, and then I had a big insulin spike, and then I went super hypoglycemic. For me, oatmeal does not work at all. And I had it with a banana and pecans. So I had brought in even additional protein. Maybe for other people it does.
Oh,
So I would want for there to be a little bit of vegetables with that particularly, and I don't know when you're having breakfast, so I don't, if you're having breakfast at 6:30 in the morning and you're hungry at 11, that might just be your next meal time.
that's right.
Yeah, so there's multiple factors, but at the end of the day, I would prefer to not see somebody having a fruit meal in general, but I'm respectful if it works for you.
We have time for one more question, Susan Robinson.
My question is, what about collagen for inflammation and joint pain?
Mhm. So I was just looking over a little bit of that research this morning, and it's mixed. So that would be something that I would very much say, try it and see what works for you. It's quite mixed. The jury is out in terms of clinical trials. But by virtue of the fact that it helps with the cartilage that's related to, it's part of the joints, it certainly wouldn't be surprising if it helps, but it's not anywhere near as definitive as it helping with the skin. Yeah.
Okay, good. Thank you. Thank you.
Oh, my pleasure.
Maybe one more question. Oh, I don't see any, Dielle. Do you want to wrap up? We have chair yoga usually at 10, it's 10:08 now. So yeah, there are some final remarks, and I know I'm thinking of one. It's good to make an appointment, get this all sorted out, rather than self-diagnose. I know that I'm the worst offender, I guess, but yeah, it really intrigued me on all of this, and especially about the blood sugar.
Yeah, I'm having a lot of fun with it, and I'm looking forward to sharing it. To sum it up, I would say adequate protein, adequate hydration, blood sugar control, and varied fruits and vegetables. Those are my 4 things that came out of this. As I always look at it as in terms of what can you do that you are not going to regret, right?
Yeah.
You're not going to regret those 4 things. And they have proven links to maintaining your skin quality. And of course, I'm missing the obvious, not too much sun, but I feel like you guys don't need me to tell you that.
Well, I'm going to say, Dielle, that you never, in all the times you've been with us, you've never disappointed. You are such a wealth of information, and your confidence comes through. I know you've done your homework, and we get the benefit of that. So I want to say thank you so much.
Thank you. And again, my sincere apologies for leaving all of you waiting. I'm really sorry.
No worries. I hope I'm speaking on behalf of everyone that we learned a lot this morning. That's for sure. So thank you so much.
Have a nice day.
I'm going to stop recording.
Okay.
Thank you.